Thanks, Michelle. Thanks. Nice to see everybody. Is anybody here nurses or work in the health industry or anything like that? There's 1, 2, 3. Yeah, I've got some colleagues out there. That's good. It's lovely to see you all. So yeah, I'm David. I was a nurse in ICU for a good 15 years, and then I ended up getting a job as, they call it, the equipment coordinator. So they've got around 2,000 assets in ICU, from oxygen taps to ventilators, compared to a ward which might have, say, 200. So they need equipment coordinators to coordinate all that stuff. And I branched into analysing the procurement of our things to try and make it better. And then I realised there's all these sustainability things that we could be doing as part of that analysis. So I'll be talking a bit more about that now. So what is sustainability? Well, my favourite definition is from the 1987 one in the United Nations: meeting the needs of the present without compromising the ability of future generations to meet their own needs. And this is a recent need that we made about 6 weeks ago, and I'm really hoping that I don't compromise his future with all the various things they're doing, particularly in plastics. So I'm going to just quickly go through myself and my district. I'm going to talk about what we're doing about plastics in our district, and then the 3 arms of action that we're doing in our district towards just plastics. So basically, as Michelle mentioned, I'm the first Sustainable Procurement Implementation Manager. That's a mouthful. I call myself the SPIM, because at least you can remember it. So I'm in the contracts office of the district, so it allows me access to our entire procurement portfolio. So we're talking over $2 billion of expenditure annually, of which $900 million I look at, basically, and the rest you can guess is probably payroll people. That's the rest of where our money goes. So I have a close relationship with clinical products, planetary health, the local sustainability committees, of which there are many passionate people out there, and asset management who buy the big ticket items. So what is Northern Sydney Local Health District? So you can see there's a bit of a map of the state. So we start literally on the other side of the harbour over there, and we go all the way up to Wiseman's Ferry. So it's about 900 square kilometres. It's about 6 major hospitals and just under 100 actual health centres, whether it be rehab clinics or all kinds of health centres. We do People Matter surveys every year. Has anyone participated in a People Matter survey? Yeah, the nurses put their hands up. Yep. What are your biggest likes or dislikes, etc. And what we're gratified to see is that in those surveys, 80% generally each year say, yes, we support some kind of climate action change and things, which is great when we try to implement plastics reduction strategies. We're the only district in the state with a published planetary health framework and full-time team. All right, so strategy 1, what are we doing in my district? Well, I'm proud to say that we're apparently leading the state in our plastic reductions and sustainability strategies. Our board and our chief executive has very much invested a lot of money and time and approvals into making sure that we are the leader. So someone like me can have a role in the district doing procurement analysis. So I'm able to, as I said, look at all the money we spend on things made of plastic and see is it appropriate or not. You can see here non-sterile gown consumptions from 2018 to 24. You can see that rise from 61,000 a year up to 163,000 in a year, and then down to 58,000 a year. By the way, that's one hospital. That's not my entire district. That's just one hospital, 163,000 a year in 2022. And you can see that our biggest use was those yellow isolation gowns you can see in the picture. And second biggest use was the blue gowns, which is the same thing, just a different colour essentially. Now, gloves, some of you smart people might have worked out, gloves are not actually plastic, are they? They're a nitrile rubber derivative. But I like the example of gloves because they are involved in the same problem that we have with all our plastics, is the way they're created, emissions-wise, how we use them, and then how we dispose of them. So I love using them as an example. 54,000 examination gloves thrown in the bin per day in my district. Apparently at the moment, regarding the, what do they call it, it's the equation they use to calculate carbon. It's 25 times at the moment driving around Australia. So during this panel in my district, 4,566 individual gloves are going to be thrown in the bin. I'm not saying they're all unnecessary, we definitely need them, but our projects around the place have shown that we can reduce up to 41% of those are just unnecessary. And in fact, they make hand hygiene worse because the clinicians will rely on gloves rather than actual proper hand hygiene, you know, those 5 moments of hygiene you're supposed to be doing before and after activities and so forth. So what is the problem? What is the problem in health? Well, what we're finding is that number one, it's composite products. All of our clinical products made out of plastic and made out of different kinds of plastic, all woven together. I think Nathan mentioned that a little bit. Xavier, you freaked me out knowing that we've got tiny pieces of plastic all in our body. And that's where all this comes from. We've got cotton loops, and we don't have the infrastructure set up yet to take those materials apart and to recycle them effectively. So what happens to them? They go in the bin. Next is low suppliers reducing the plastics in health. It is happening. Big companies very much are investing a lot in reducing plastics or using recycled plastics, but it's not a mainstream initiative at the moment. It's more like a jump on the bandwagon so that we look good sort of situation. And the profit for them is just not there at the moment. And lastly, plastics in health. Believe it or not, we actually need plastics in health. So Dr. Stanley will tell you some of the things he needs to do the work he does, they really just have to be made out of plastic. There's no way around it, okay? So there's a massive, massive requirement. Working on reducing that, but it's always going to be there, and the burn rate is always going to be high, especially as the population increases. Strategy 2, implementation. So how do we implement something that will reduce the plastics we use or address the types of plastics we use? Because as Dr. Thavi mentioned and Dr. Stanley mentioned, a lot of what we use is, actually Nathan mentioned as well, it's like a lot of it's PVC, polyvinyl chloride. Well, firstly, my role currently is to create mandatory sustainable procurement policy, create supplier evaluation criteria, and then create education bundles for staff and businesses. So that's my top-down approach. So I'm making it basically compulsory that in our procurement for our district, as we procure, sustainability is not only a consideration but a mandatory part of the process. And eventually we're going to have a database of all of our suppliers, how sustainable they are, and we're able to guide my $900 million of procurement in the direction of sustainable choices. And our trials so far have shown that while the initial procurement is maybe 5 to 10% more expensive because the criteria are now competing against pricing criteria, we're finding that in the long term, the financial savings are massive, because often it means that things are more reusable, will last longer, they're higher quality, and the companies tend to be, the ones who invest in sustainability tend to be more reliable and a higher value to us as a district. And then I've got other relationships like with the Planetary Health Team, the Department of Climate Change, Health Share and so forth, and I'm able to do a bottom-up approach and try and work with the teams to all of our little projects. And that leads me into strategy 3. So you can see there on my slide, there's a list of all our, well, not all, some of our major sustainability groups that I work with. We meet every 3 months around the hospitals, and they initiate projects based on what they feel they're capable of doing. We reduce, recycle, replace, remove, and now that I'm here, I can capture that data and show that data to everyone to try and inspire them to do more and actually show that we're actually doing a good job. There's a slight error in this slide just at the top there. Just ignore that with the description of post-project single-use finger. But these are results from projects that I initiated at Westmead ICU. So we basically empowered the nurses to make a change. We didn't make a mandatory change. We didn't take away a product and say, you will now use this. We basically said, okay, we're using plastic pill cups, but there's a biodegradable option. Put them together, educate everyone and say, would you like to use this instead? Obviously, you need to use plastic for like liquids and stuff, but the biodegradable option most of the time is perfectly fine. And as those of us who are nurses, what do we do with pill cups? We go like this, we give it like this, and then we go like this, and we do that, 20,000 times a day in the state, right? Next is slide sheets. This was a thing where work health and safety required us to have a safe way to transfer patients from bed to bed. So they decided, let's invent PVC or polyester slide sheets. So these companies make these things called slippery sallies, there's other version of them, and we roll the patient carefully, put them on the slide sheet, transfer the patient, take them off the slide sheet, and then the slide sheet goes in the bin. So you can be in a radiology department where you're doing, how many CTs a day? Some of you probably know how many CTs per machine. Every single patient coming through, bin, 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 cool. So my radiology at Western Sydney was around 25,000 sheets going in the bin a month. So we were able to say, hey, is it cool if we use a reusable option that we already have? which is the linen service gives it to us, we use it, and they wash it and then they give it back to us. And they were like, if you want, sure. So we did it. And the last one was finger probes. And this ties into what I love Dr. Stanley's first slide. He talked about how it's kind of entrenched behaviour, and it's also corporate interest coming in and saying, okay, how do we make a profit? Machines are kind of peaked out now. They do what they do, and now there's little enhancements. I know, instead of using a reusable finger probe, which we just wipe down and put on the patients, let's put on a single one and then tell them it's the best technology. It's better than the reusable. It's awesome. And nurses will go, awesome, put it on, works great. Oh, don't like it, peel it off, throw it away. Another one on. Oh, yeah, it's a bit yucky now, peel it off, throw it on, and so forth. So in 2023, we burned through just over 7,500 finger probes in one unit, in one ICU. And that cost us $123,000. So I said, hey guys, would you like to use the single-use probes instead? And they were like, yeah, whatever, sure, that sounds good. And we got a massive reduction, and so my graphs reflect that. This was a huge saving in 15,000 cups, 1,500 slide sheets, and 4,800 finger probes in 13 months, which in the end resulted in 327 kilos of plastic not going to waste and saved that one unit $75,000. So this is a very sort of bottom-up discussion as opposed to the other speakers talking very top-down, but that's kind of what I'm here to talk about. Imagine if I couldn't achieve this for one unit, what do you think we can achieve if we were to distribute these strategies across whole districts? And that's what I'm trying to do at my district now. Thank you so much.